Drill 6. Breaststroke pull, pulling the body to the hands. Focusing on all of the previous points, start in a streamline position and after every full pull, hit streamline. It is important that as soon as the swimmer sculls out, they hold as much water as they are strong enough to, normally outside of the shoulder width. Then, turn the hand to face back down the pool, trying to pull the body towards the hands, not pulling the hands towards the body. On this drill, the swimmer has increased the difficulty by not using a pull buoy. At all times, your legs should be held high and in line, pointing back down the pool and not allowing any drag with the heels and toes snapped together.
Pectoral smash with auxiliary arm movement. The area that the swimmer should initially work through is from the edge of the sternum, which is just off the middle end of the trunk, through to the front of the shoulder. Secondly, to work over the front of the shoulder, beginning just at the top by the clavicle, down to the bottom of the shoulder in the groove between the shoulder and the bicep. Thirdly, into the deltopectoral groove located between the shoulder and the chest muscle. The movement of the hockey ball should be a small side to side, up and down, or oscillating circular motion. The combination of these movements are best used to maximize tissue penetration and release. This form of localized pressure allows the hockey ball to knead into a specific area of the muscle. To increase the intensity, the arm can be brought behind the back. Also, leaning into the wall will allow control over increasing and decreasing the intensity. A second technique that can be used is the auxiliary movement of the arm whilst the hockey ball is held still in one place. This form of technique allows the hockey ball to work into a more global area of the muscle, by the muscle moving under the hockey ball rather than the hockey ball moving on top of the muscle, as in the first technique. This technique can be done, but is not limited to, arm movement that follows a forward, backward, and out to the side motion. The hand can also be rotated to allow a greater range of the muscle belly to be worked through.
Behind the back stretch with fists. Standing with feet hip to shoulder width apart, feet facing forward, pelvis in neutral position. Bringing the fists together behind the small of the back. Elbows are drawn back to increase the stretch across the chest and front of the shoulders. The shoulders are always set back and down along the spine into a neutral position. The swimmer should keep their head looking forward and in a neutral position. Maintain a spinal neutral position at all times, reducing arching of the lumbar spine and flaring of the lower ribs. Internally rotated, bent over lat stretch. Firstly, the swimmer must adopt a straight neutral spine. Then hinge at the hip, taking hold of the rack with thumbs facing down. The swimmer must attempt to drop the chest as low as possible while pulling back. This will acquire a stretch along the latissimus. For the swimmer to increase the stretch, the swimmer can slightly lean to one side, whilst still pulling away and dropping the chest down.
Overhead band scap set. The swimmer begins in a seated upright position with the spine set into neutral. The shoulders start in an elevated position. This can be seen with the shoulders and the upper arm raising against the side of the head. During the movement, the shoulders are depressed back and down, activating the fibers of the lower trapezius. From this angle, the muscles of the mid and lower back can be seen becoming active to facilitate the downward movement of the shoulder blades. Alternate arms Blackburn. The swimmer begins in a prone position, face down. The swimmer's legs are squeezed together. This will activate the adductors on the inside of the legs. The hips are drawn into a pelvic neutral position. This can be seen with the arch of the lower back becoming flat. The swimmer's chest and forehead are placed on the floor. The hands are placed into the small of the back. Before beginning the movement, the shoulders are set back and down and the elbows are raised high. The swimmer must maintain these positions throughout the movement. During the movement, the arms are moved in a large circular movement out to the side, finishing overhead with the thumbs pointing up.
Side plank. The swimmers adopt a strong spinal neutral position. There should be a straight line between the feet, knees, hips, shoulder and head of the swimmer when in position. The swimmer's elbow should be directly under the shoulder. To ensure this is achieved, when setting up, the supporting elbow should be placed under the armpit rather than the shoulder. This way, when the swimmer raises into position, the elbow will be directly under the shoulder. The supporting shoulder must be set back and down